Antoinette and Friends, you guys. Just let's answer this one question. This is from Italy. What have you learned? I'm translating because you know I speak Italian.
I speak Italian too. Get the hell away from me.
There wasn't a woman who looked like us. They were all grown, and they were talking about their facelifts to their husbands, which is where I am now. That's exactly my career.
You are such an open book. I want to know something that nobody knows about you, and I'm going to get it out of him today.
I might have forgot what nobody knows.
To me, like to watch as a doorman and to watch all these great comedians, it was like a college. It was a college of sorts where you got to watch the professors every night, you know, and you can learn as much watching a bad comedian as you could watching a good comedian. You know what I mean?
Did you get laid that night? And he said, yeah. I go, now I got to start carrying around a notebook and pen. But that's a true story, and it just made my day.
I think we're live.
Oh, hey.
Hi.
How are you? What's up? Good to see you.
Hey guys, so here's what's going to happen. We are live right now on Instagram, and then right after our broadcast, we're going to go live on Facebook and YouTube.
Fun.
Like I said, 3 times is a charm. I've been wanting to get Dr. Michael Anthony Spagnoli on my show. Thank you, Marina. Since I started the series.
Cheers.
You know, and cheers. I don't even know if I'm able, well, I'm probably not able to say who his clients are, but let's just safe to say that you could go to any supermarket checkout and look at the magazines, and that's pretty much who his clients are. His healing hands have touched a lot of people. Am I wrong?
Yeah, but we all the same body, so superstar client.
But I have to say but he's really put his healing hands on my nearest and dearest, and he's helped me through a lot, like adjustments in my body that I didn't know I was going through, and he's helped me kind of maintain a youth and a vitality, and I just love that he makes everybody feel good when they leave. But beyond that, he's got this amazing ability. Now, you have this philosophy that includes the whole body. And right?
Well, I do. What a nice intro.
You can go now. Come into frame a little bit.
Okay.
It's okay. We can get cozy.
Okay.
Because we're on Instagram now.
Right.
Bye-bye. Hi. So.
Oh, okay. We're still on?
We're still on.
Oh, I thought you guys
still on. We're in real time, I think.
Bye-bye.
They were trying to close out that screen.
Got it.
But anyway, how are you?
I'm good. Rough night in the valley, you know. It's 124 degrees, the hottest day ever in California. I've been here 30 years, and I had no air conditioning. So
I don't even
brutal.
understand. But
brutal.
why did that happen?
How would I know? I mean,
it was just
the
like
air conditioner
a rolling
just overloaded
blackout?
and stopped.
Wow, that's
Yeah,
crazy.
so
I was sweating in my own. Right, I was talking on the phone. I was literally dripping. I thought this is really difficult, and I imagine a lot of
beyond horrible. Just last couple days. I can't stand the heat. Anyway.
But you're doing okay.
I'm doing fine. Yeah.
And can we say that you had COVID?
I did. Yeah, about over 2 months ago.
Which was shocking, or not?
Not really. I was, in practice the whole time. I was following all the CDC guidelines, and I've been doing all my posts to try to educate my patients on how, if you do get it, which, as you can see, a lot of people are highly contagious, how to have your body ready to fight it off. And luckily, I experienced 2 pretty bad days. First sign of fever, headache. Second day, body aches. Within 3 days, completely gone. And then I just couldn't smell, which was the worst thing ever for me, because I'm Italian. And couldn't taste. And I started aromatherapy training as prescribed by a very dear friend of mine. And here I am a couple months later, and thank God I feel great.
You're a healthy man.
Well, yes, I've been practicing kind of what I don't say preach, but I teach. The word doctor means teacher. More people should know that. Teacher.
That's interesting. I didn't know that.
Yeah, well, yes, physician is diagnostician, healthcare provider is healthcare provider, but we've been inundated and brainwashed by the word doctor.
Right.
It just means teacher. So
yeah, and that's what you do.
You
empower your patients.
I do. I try to let people know that if you give your body a chance, within reason, without being overly, I'd say, fanatical at anything. You can live a long, healthy life, and it kind of revolves around posture for me.
I know it does.
Posture is a big thing for me.
So that's the most common thing that you tell.
Well, I tell every patient that there's no reason to be in fatal flexion, that you're always going to live longer when you're open and when you're in line with gravity.
Right.
All your organs stay in the right place. Your brain is centered over your body. That's your master computer.
Right.
Everything works better. You breathe sometimes a third more oxygen all day when you're 1, 2, 3. I call it get spagged.
Yeah.
And it really is a very under discussed major problem in our society. Just most people are hunched over, and we've gotten accustomed to accepting it as kind of normal. Head forward, closed in. You have to open yourself back up, and that's where the aspect of manipulation, exercise intervention, as far as like teaching people how to strengthen up their extensor muscles, so it becomes normal rather than abnormal. So
Right.
you are normal. You go, wow, you have great posture. They go, I do? And you go, well, yeah, because you're strengthening an extension, not going into what I call fatal flexion. If I stumble my words, I haven't slept last night. You guys,
I have to say, the third visit,
yeah,
I walked in and you went, hey.
yeah, yeah.
I mean, I started to do the exercises that he gave me, and just to be body aware. And you teach body awareness.
Well, I do. I call it, for a couple of reasons, I call it being a posture cop. COP, cognizance of posture. And on a crass way, which I carry on my page, to say, don't walk around in this life with your head up your ass, or you don't even know where you are. You should always be spatially aware. Can I stand up?
Yes,
Let's
please.
spin over here a little bit. You should always be aware of where you are in reference to gravity, because gravity is always forward and it's omnipresent. So anytime you're past that gravity line, gravity wants to bring you into a crushed posture.
And you just become more and more and more and more hunched over.
Well, yeah,
Thank you.
it's a self-fulfilling prophecy that with the weight of your head alone, 10, 12 pounds, once you're past that gravity line, it
Right.
becomes 80 pounds.
Right.
So when you look at other people, and you know, a lot of people have body issues on body shaming.
Right.
I don't have to worry about that because
Right.
it's my profession. It's how I teach you the longest, healthiest
Right.
life.
Right.
So I can say, your posture sucks, you're overweight, you're lazy, you're in denial, and you have a lot of excuses. And patients go, excuse me, I go, you heard me.
I love that.
I'm not gonna lie to you.
I love that.
Cracking your neck, cracking your back. I mean, that's a fairy tale.
Right.
It really is learning about your entire presence in a universe without being too esoteric and where you are and correcting it. You can correct it just like that in 1 second. You want to do it with me?
I do.
Okay, we'll do our 1, 2, 3s. Ready? So,
Excuse us.
it's called getting spanked.
This is getting spacked.
Just
But I
mimic
want you
it.
to be in frame with
I'm
me.
in frame, right?
We're not getting you in
You're in
fresh.
frame.
Gotcha.
Okay.
You're in frame.
Yeah. Okay.
Okay, let's go 1, 2, 3. Under the breastplate. Lift up. 4. Pull your ribs apart. Chin comes up a bit. That's your vital diamond right there. Let's go back 5. 1, 2, 3, 4, 5. Let's go straight up. Let's pulse together. Keep that chin pointing towards the ceiling like a laser. Get your chin up. Get your
Feels
chin
so
up.
good.
Chin up. There you go. Now make a T. You always want to look like a T, not a C. A little more chin. Better. 1 and 2 and 3, 4, 5. Post up. No, get your chin off your chest. Ah. So that's your vital zone right here. So you want
It's
to
such a
maintain-
weird thing because you almost feel like it's like it feels like really
Well,
not
that's
comfortable.
a psychological thing. Most people are afraid to have this open, the diamond of health and beauty. We're almost done. Here we go. Here we go again. A little shoulder shrug. Get a little Italian on me. And now move just from the back of your head. Tick-tock right there. Good. So your diamond of health and beauty is literally your chin, tip of your shoulders, sternum, and you never invade that diamond with your head or your shoulder blades. You always stay behind it. That alone will change your life. Just like that. Just that little
You're
intervention.
just standing here. I feel like. Oh,
Well, I mean, a lot of people are afraid. Women, even more so than men, psychologically.
Well, it's psychologically we're
you feel
not
like
taught
you're-
to do that. You feel like you're being boastful. You feel like you're walking around like a peacock, and
Well, tough shit.
it's more healthy.
I mean, well,
I'm
it's
so
no, it's really not even that. It's about the stigmatization of trying to have good posture with as a woman or a man.
Right.
It really is the first thing people see on you, and that includes their whole idea of who you are as a person. When you come in like this, hunched over, you don't look like you're even happy to be alive.
Right.
When you come in proud and upright, it sets the precedent for who you are as a person, and you're breathing a third more oxygen, and your body doesn't break down. So that's really the big thing about chiropractic physicians is that we teach, we teach people how to have a certain structural presence that just assists them in living the longest life with the best quality. It's not just longevity, it's quality. You want me back on the
I
table?
do. Can you
Should I
come
come
back?
Yeah, here.
Back on my table?
Yep. Hey, I'm doing okay. I'm not stumbling on too many words for
Okay,
being
you,
sleepless
this is the question I was thinking about last night. You do something different every time with me, so I'm assuming you do that with everybody. What is the technique that you use? Are you intuitive? Do you look at the body? Do you listen to what I'm saying? Is it all three of those things? And how, two-parter, how can you tell the difference between inflammation and something that's chronic between an injury, an old injury?
Well,
I think it's an old injury is chronic.
Well, I mean, when you're a healthcare giver and you're actually a physician, you have to do a proper history. So believe it or not, if you do the right intake on consultation, 12-point history, you can usually make a diagnosis right from there. So we talk about inflammation versus chronicity versus acute pain. There's a lot of questions I'll ask that to me are critical, like, do you have nighttime pain not relieved by position? To me, that's a red flag. Meaning that if you have pain anywhere and you're moving around, it doesn't change, you're perfectly still and it still hurts, you go right to the hospital. It's usually an organic or pathological problem. Not always, but mechanical pain is usually when you're lying still and you go to move, oh, my shoulder, you go to turn, oh, my back. I'm not as worried about that.
So if you have a pain that doesn't go away by moving around, that's something you should
You have a pain at night
think about.
and you're lying perfectly still, and you go to move around, it does not change, or it's worse at night. You asked about how I actually start to formulate a diagnosis or opinion. That's a red flag for me. Weight loss, quick weight loss, PM pain, an area that you palpate, first you auscultate to make sure there's nothing underneath it, that looks abnormal. I do not take any chances. I just don't. I use other diagnostic studies when indicated. And when they're not indicated, I'll wait a few days. If that answered your question.
I love that.
Yeah, I mean, look, common sense rules. If people would only, again, connect their mind, their body back to their existence, you wouldn't see what we have. It's carnage out there. To walk around and see how out of shape people are and how hunched over, it makes me sad. There should be a line out my door to Tijuana, Mexico.
How disempowered people are around health, because it seems like I don't want to say the medical profession in general, but you know,
Why?
Because I think there are great physicians out there, i.e. you.
Yeah,
but it's like we can take care of ourselves, and we have to be really mindful about the things we eat, the people we associate with, the air we breathe, how much walking we do we smell the flowers, do we eat good food, how much time do we put into good food, how much time do we put into preparing our food. These are really simple things.
But I think that what people forget is that, without being too macabre or too negative, you're going to die no matter what. I mean, everyone's going to die, but no one really believes it. That's kind of a cliche that I use, because you're trying to get to, at least in your late 80s, 90s now, functional. So you can be a fanatic here, you can go get organic food, it'll lower your chance of certain things. However, just simple interventions and simple things that you include in your lifestyle habits will make the biggest difference. Yes, well, talking about treating patients, you brought up, where am I intuitive? It's not that I'm intuitive, but I can usually tell by what you tell me you come in, what I see, what I palpate, how you're moving, what I need to do. So I do rarely
I guess that's a skill, but it's
well, and I am a little bit,
and
intuitive.
Yeah.
Terrible gambler, but I mean, I think I'd be better intuitive on that note. But everybody has to be assessed on a daily basis. Of course, if you break your leg and you come in for therapy, or if you've broken a vertebrae or an arm or shoulder or rotator cuff, that's a little bit different, because you've got a torn ligament, torn muscle.
And may I interrupt
Sure,
and say,
absolutely.
would you then send somebody elsewhere and say, come back to me when you fix this? Or like, what's the things that you're like, that's out of my range? Or you can help them
Well,
before
I don't
they
think
go there?
anything's out of my range. I mean, I diagnose, unfortunately, cancers and things on patients quite frequently. So I can always teach you how to live a better life by how to walk correctly, how to sit correctly, how to breathe correctly, how to stand up out of a chair correctly. It's all on my Instagram, but these are things I can do for anybody. Now, I've always had medical physicians in my clinics, physical therapists, acupuncturists,
There's a lot of
homeopaths,
different people
tissue
in this
therapists.
office.
I've had
Yeah.
everybody. We all work together. Remember, this is what's forgotten in this society. It's all about the patient. It's not about the quote doctor. Who cares? And that's the problem with our whole healthcare system. People are just infatuated with the word doctor. I mean, the education's not that great. I mean, you get better education when you're
It's a
in the field.
practice.
Yeah, and I've been in practice 34 years, and I'll tell you right now, I was trained by an osteopathic physician in Connecticut my first 2 years out, who they called him God, because he was that brilliant, and his best part of his brilliance was his ability to assess the situation, and above all, which every healthcare practitioner, the creed we take, do no harm. So when you put financial gain and you put ego together, it's a prescription for disaster, and that's the biggest problem, in my opinion, in this whole world. Doctors should not think they have to make $2 or $3 million because they went to medical school. So I don't want to tell you how many patients in 34 years that I've stopped by them coming to me by luck or referral from having surgeries that would have been really detrimental to them, and many other things, like thousands. So is that a criminal act? I think it is,
Right.
personally.
Amazing.
And we accept it. You know, we accept so many things in society that I like to feel that I teach my patients not to be sheep led to slaughter. That's my big thing, is take a giant step back and say, does that make sense? And remember, too, that capitalism in medicine is horrific.
Big
Whether it's a
pharma's
surgeon,
real.
well, that's true. And there's some great surgeons saved my family's life, saved my life. Some meds, but I'm not discounting that. I'm saying
course not.
you've got to do the proper intervention with the most efficacy and the most safety. That's why I love being a chiropractic physician, because I can do the proper intakes and then use all disciplines together for the betterment of just the patient. Period.
Right.
That
Now,
make sense?
yeah, I love it. I'm going to throw.
This is Laura and Sarah Fan, my producer.
I'm
You're
about
hearing
to-
this voice.
Surrounded by Italians.
I'm about to throw Antoinette under the bus.
I thought you were about to throw up.
No. So last night we were giggling, and she doesn't stretch and can do the splits, all the splits, and she just does them.
That's genetic.
And she.
But I mean, literally, last night,
She hasn't done it for
I
20
jumped
years.
up, and I went down into a split, and I did all three, right?
Is that your comedy act?
I
throw
woke
that in
up
there.
this morning, she slept over. I woke up this morning, I was like, ow.
Yeah, well, you know, simple
I was-
sprain.
But I forgot that I did it. I was like, what the fuck? Just
simple
like you were,
sprain.
yeah, but I don't stretch.
It's overrated. If
Okay,
you do your posture stuff,
That's amazing.
overrated.
Overrated if you're flexible.
I mean,
No, overrated if you're not flexible. Stretching, if you look at really stretch,
Okay.
I don't want to get into
Okay,
the.
this is
into the
good.
basics.
Here's
Listen
the good
up.
one.
You're really stretching origin insertion. It's really hard to get to the actual muscle belly itself. So the myomeres in the muscle, I mean, they don't really get affected. So just your simple full range of motion movements that I'm not promoting what I do, but in my posture power classes and what I actually teach and I exercise to, all my movements are always full range of motion with natural stretching. I don't like holding the position. When's the last time you saw a cat stretch for half an hour? Or a dog?
What about the foam roller things?
Overrated. Overrated. Damages tissue. You
You,
know,
you just mentioned posture classes. What is that? Is that where
Well, I
we can
teach
do-
posture classes. What I was going to say is that everyone's looking for an easy way out. Foam roller, massage gun,
Yeah, the gun. I have
CBD
that.
oils. I mean, people don't want to eat correctly. They don't want to stand upright. They don't want to get adjusted. They don't want to sleep. They don't want to learn to like cast shit away and not be so stressed out. People have a hard time admitting that they've got issues they need to like work on. They're looking for the quick fix. That's why drugs are so popular. That's why I'm going to get back surgery, neck surgery. They're prepared to make the change themselves. I've been trying for years on some patients, and they get it for a while, but they go back. A lot of them get it forever. And the most important thing, again, is once you learn about where you are with your posture lines, you'll think about it. Who's ever watching right now, I'll promise you, you'll never want to be hunched over again. And you'll look at someone next to you like that, and you're going to get spagged 2, 3, 4, 5, and then you move from the back of your head. That is the most important thing. Moving only on the occiput, your skull, and your first vertebrae. It's the only joint in the body that the old adage, where the head goes, the body follows, does not apply. Because you can move your whole head like on C1 and not change your spine angle. And again, look at the physiology of the body and look at where your vital organs are. Look at your master computer, your brain. Comes out of a hole the size of a silver dollar in the back of your occiput. Feeds 31 nerve roots all the way down to the bottom of your toes and loops back up. Every organ you have in your body is hooked up to a nerve from your spinal cord up to your brain. You live within that brain and central nervous system, no different than a jellyfish, but with a bunch of ligaments, bones, and tissue around it. Invertebrate, vertebrate.
I love
So you
it.
can walk and talk. Too much? Too much?
No, that's amazing. It's amazing. I'm gonna
4 cups
watch
of
this.
coffee, no sleep.
But I know you didn't have any sleep. Can you do a quick
I'm not
talk
gonna,
on
I'm not
sleep?
Gonna say it again.
No, on
Oh,
sleep.
on sleep,
On
it's
what
my number one.
People brag about, I only need 3 hours of sleep. That's not true.
I can't answer for that. All I can tell you is that in my Dr. Spagnoli 12 Ways to Live Longest, it's number 1 on my list.
Did
If
you
you don't,
hear
because
that?
you have to repair.
Sleep.
You have to recharge. You have
Number
to,
1 on his list.
Your good hormones come back out. Your bad hormones elevate. Your cortisol levels, your adrenaline, everything is detrimental to your cardiovascular system happens when you're under duress and stress, and that's from not sleeping. Sleeping is horrible. I'd rather have someone with a bad diet than that doesn't sleep. Someone who doesn't
That's
exercise. My
really
parents,
powerful right
my
there.
parents lived. My mother to almost 100. My dad 94. Point is, they never exercised. They never stretched. They never used a massage gun. They didn't take CBD oils. They ate a lot of pasta, garlic. Didn't really drink. However, they slept every single night, and they went to bed kind of early. Not together, usually. That's another story.
So what's the
Sounds
problem?
like my
How many
family.
hours?
Who snores? Who moves? Huh?
How many hours of sleep?
I will say, honestly, a minimum 6, maximum 8. People oversleep too. Oversleeping throws off all your circadian rhythms again and changes all your hormonal cycles. So you got to get on a program, and you know that when you're on a, say you go to bed at 10 o'clock and wake up at 6, who needs an alarm clock? You're up at 6 as your body secretes the proper hormones to wake you up. So you got to trust the innate intelligence of the body. You know, we breathe, we digest, we eliminate. Another thing no one ever talks about is going to the bathroom, but that, I don't want to talk about that today. Next show. So we take things
Episode
for
2.
granted. You know, like the garbage disposal in your sink, a bunch of stuff, you put the thing in there, you use the restroom, you flush the toilet. You never really think about anything, and that's a problem with human beings, in my opinion. You're not really aware anymore, and things kind of overwhelm you. You got to become a lot more self-aware and use your own intuition on what makes common sense. That's all. I don't care what kind of healthcare practitioner you are. I don't care what kind of shape you're in right now. In 1 year, if you just put the proper interventions in, you can restructure your whole entire body as long as your telomere, look it up. Everyone should learn about your telomere and your telomerase. It's a little Q-tip on the end of your white blood cells, which gives you the ability to further split more cells about every 8 years. So there's a lifeline to that telomere, and you want to elongate it. You don't want to shorten it. Shorten it. Bad diet, stress, no sleep, too many cigarettes, too much booze. And trust me, I'm no saint. But
And you drink coffee. We talk about that. You drink
I drink a
coffee.
lot of coffee. It's
When
one
you
of the
say a
best.
lot of coffee, what do you mean?
Maybe 6 to 8 cups in the morning. Yeah.
Wow.
Well, I
But
mean,
you
if you
don't-
look at the
but you don't drink
benefits,
it after a certain
look at the
time.
benefits of coffee. You should look it up. Detoxification of your liver, keeps your blood sugar levels in line. It's got amazing array of antioxidants they can't even find. They can't even really formulate.
Doesn't that make you
And
happy?
my mother and father, again, I use the Italians, the ones I watched. Pardon me. My mother and father drank 6 to 8 pots of coffee a day. Oh no, see, that's the first reaction. Is like, oh my God. But good coffee. I didn't like their coffee. Chock full of nuts.
What coffee
Mostly
did your mother and father
Maxwell
drink?
House coffee.
Yeah.
I grind my own beans, and I don't drink coffee after 11 in the morning. So I drink in the morning. It's good for you. Look it up. You gotta research things out. Research for yourself. Don't believe anybody. Don't believe hardly anything you hear. You have to actually study if you care.
And you
Take
have
some-
you have to listen to your body and be more
Yeah,
intuitive.
look in the mirror and don't deny and say, I can do this, and get motivated.
Mm-hmm.
It doesn't take much. Just a little bit of oxygen in the morning. Get on a treadmill at half a mile an hour. I promise you in 5 minutes, your happy hormones start coming in, your
Right.
endorphins, your
And it's much easier to
Then
stay
you go
on.
a little faster,
Yeah.
put a TV there, put your screen there. I don't care what you do, but get your body moving and do it in proper posture function lines. That's my big thing is when you train, make sure you're training in extension and back.
Could you do an adjustment on me?
I think I forgot how to do those.
No,
Of course I will.
but we'll do an adjustment. But I also, everybody knows who follows me knows that I'm really super interested in the moment as a child that you recognize that this was your avenue in life, and I really want to know about
I
that.
knew right away. Oh, I was a graduate from Southern Connecticut University, had a biology and phys ed degree. Was going to go to pre-med and do my nutritional physician direction as an MD. I was working in a nightclub, pretty good one,
As a what?
as a bartender and occasional bouncer, just so I could get
Yeah,
a few
so you
rabbit
did
punches
it.
in on some guys that deserved it. And this chiropractor who came in quite frequently, really fit, really healthy looking, really great personality. Everyone knew him. He was a presence. And he said to me one night, "What are you going to do?" And I said, "Pre-med, nutritional physician." He goes, "Nah, you're going to be a chiropractor." And I laughed. I go, "I've been going forever, and osteopaths. My mother and father, our whole family." So he said, "Come to my clinic on Wednesday, and you can follow me around." I said, "Okay." So I show up in Hamden, Connecticut. There he is. He comes out, his little Dr. Jack. He's like, "Oh, hey, doctor." And I laughed. "Hi, doctor." Huh, funny. He goes, "Just a couple minutes." 2 minutes later, he goes like this to me. I follow him in the room. Close the door. The patient went on an old Zenith high-low, these chiropractic tables that go down really slow. They're really cool. Too narrow for me to adjust on, but he liked them. He walked over to the patient, put his hands on the patient, looked over at me, and I got hit by the literal thunderbolt. And I put my hands over my face and said, I was destined to be a chiropractor. Destined. And then I wanted to kill him for the next 6 years. I suffered through 5 years in Chicago and my residency, but it was a calling for me, and I love it. I've helped so many people, taught a lot of people, and changed their lives, and saved people from other things that could have killed them. So I love it. I'll do it till I can't move anymore.
He really has.
Yeah.
And you've helped my two sons have an awareness at a young age of their body. Yeah, you really have. In fact, we met each other at the Canyon,
That's right.
right? And you were there with your family, and it was just like an instant connection. And my son had been having issues because he's so tall, and he was having back issues.
Yeah, those were a bunch of patients of mine, actually. I took that night. You were kind enough to get them in there.
Yeah, that's
So,
awesome. Okay, you want to adjust me?
sure. Absolutely.
All right.
Okay. Do you want to give me your jewelry?
You know what? Let me just say this: that
I've-
I'm in pain in the left part of my whatever this is called.
Gluteus sacral.
Yeah, because of the splits I was doing last night. I think.
Okay.
So what do I do?
Well, I'm not going to adjust your pain away from your sprained tendon. Oh, lay right on your back.
Okay. Can you adjust the camera?
I
so
don't- I don't
they
think
can.
so.
They can see.
I mean, I can see. Yeah.
Antoinette's
this
a patient of
camera.
mine. She's been
It's over
examined.
here. This is where we are.
I would never just adjust someone without a proper workup, proper history, consultation, physical examination, any other diagnostic
She
imaging
feels
that
good
may be
already.
needed. So this is not.
Can I turn it?
Yeah.
Something
you do whatever
that-
you want. I don't
There you
think
go.
it works that way.
I don't know.
You
I'm
have
just
to do it.
loosening up Antoinette first, checking out her range of motion, see if she has any catches or if she's resisting at all. Any pain during the movement of your arm
No.
and shoulder?
No.
Stimulate some of the periphery here. Remember, we're always working central nervous system. Anytime you're working on the body, you're affecting the entire neurological system. Chiropractic medicine is based on neurology. It's not based on cracking your neck or cracking your back, contrary to what the other people want to have dealt to the public of what we do. And I don't speak for all chiropractors. As a matter of fact, I don't like most of them.
So right now you're sensing what I'm.
Well,
what
I'm
having
actually
a problem
loosening
with.
you up a little bit and getting you ready if I do choose to adjust you. So, with a sprained glute in that side joint, more than likely, I probably won't do anything aggressive on your low back, but I will do some release work osteopathically. Let's bring this knee straight up.
You guys, my pants are too tight.
Well, if they split open, just cut. Any pain there?
No.
Good.
Oh. Ow.
That's not good for the public out there. Now start to laugh and say, that feels great.
That feels
Okay,
really
so
good.
you do have a little bit of inflammation on your sacroiliac joint, which is already diagnosed from what you told me you did. So on the right SI joint,
Uh-huh.
and we'll just check the other side really quick. And I am going to actually adjust it. because you're a little bit limited here in a little bit of your range of motion. on that.
Right there, right. You
So
went to the
let's
spot.
come on your side. It's real easy. There's nothing aggressive about it. If you're set up correctly, it's very, very, very gentle, very simple. That's it. Other side. Relax. Good.
Ah!
Good. Perfect.
Oh,
Sit
wow.
your back. And let's do your anteriors too. I always do these to keep and accentuate your extension posture position. Cross your arms on your chest. Bring your chin down. And let's exhale out. Let's go. Let's go. Fall straight backwards. Very nice. Make you a little bit taller. Grab my hands. You're always trying to stress elongation and eccentric muscle movement. Eccentric means that your muscles are straight out and long. Concentric is short. So you always want to err on the side of eccentric movements. Full range of motion, not truncated. Like here's a truncated shoulder move, like that. That's full. Here's a truncated move out. That's full. So many people do so much that their muscles actually shorten and never have the ability to utilize their origin and their insertion. So when you're long and you do eccentric work,
Love that.
you will function better. Let's open up that hip joint just a little tiny bit here. Nice. Recheck your ankles on here. Boom. Gotta love that. You did administer that hip adjustment about 3 or 4 times a year. The chance of having a hip replacement will drop to about
I
0.
feel like I'm like 2 inches taller
Last
right
time
now.
back to me. Let's check your cervical spine. Now all the rumors you hear about chiropractors giving people strokes, let me tell you. Personally, I've never ever heard of one colleague of mine ever having that happen to him. If it happens once, it usually is an aberration. It's headlines all over the world when the 3rd leading cause of death in this country is iatrogenic,
What's
doctor-induced death, surgeries, and drugs. One chiropractor has a patient who does a C-spine adjustment, neck is an issue. It makes headlines because, in essence, they really don't want the education to be out there on how safe structural medicine is. It's true. I'm sorry. But that's just the way it
It's
is.
true and sad.
It's true and sad. And I'm never actually anywhere near the spinal cord. I'm always right on the vertebral bodies. And that's so gentle and so simple.
Oh my God.
Up, 1, 2,
Feels
3.
So good.
And turn to the camera. Slide over one panel. Let's get back here. Let's bring it up.
I love my job.
Here we go. Yeah, right. And 1. And 2. And 3. Let's get some range of motion back in your neck. Rotate to the left. Push gently on my hand. Relax. Turn a little bit more. Push. You okay there?
Yeah.
Excellent. Perfect. Push my hand. A little more. Push. Relax. Let's get used to moving from the back of your head. We're tick-tocking from here. 3, 4, 5. Put a little extension work in your thoracic spine here, and we're going to be done. Now, this is just a balance. This is structural medicine to make sure every single vertebrae, joint, elbows, wrists, hands, knees, feet, that when you're actually moving, they're not wearing away on themselves.
Oh my
So
God.
as we say, every body needs a mechanic. Kabish.
Yeah.
Look up, stand up in one piece. Perfect. Face me. Quick 1, 2, 3. Yeah, go sideways. Now come to the camera. Just a minute. Ready? 1, 2, 3, 4, 5. I'll let you drop out. Shoulder shrug. Bring one foot back. Get that chin a little bit higher off your chest. Now move just in the back of your head. This is what you practice all day. Fingers on, they're called the mastoid process. They're off the occiput. And that's your main mover.
Wow.
Even in rotation.
That's amazing.
Now watch, when I'm up here like this, and I gotta move, call me,
Spags.
yo! I don't have to move from the lower part of my neck. Even when I'm talking to someone, I can be offset, I can be open, and I can move the back of my head. For the one main reason, you wanna breathe. You don't want gravity to wear away at your discs.
Right.
You want your organs, your major organs, your liver, your bladder, everything, your lungs, you want them in the middle of your body. The physiologic, the vision posture line is picture a line, a plumb line drop, right behind your mastoid process, your axilla, armpit, your hip, and the front part of your shin. So when you're actually out in public, when you're home, when you sit, you always sit like this. Watch my Instagram, like a duck in a pond. You get in a chair. Every time you get up, you always get straight up. How do most people get up? They get up in fatal flexion. And they wonder why their back hurts all the time, or why they're hunched over, or why they look 30 years older than they really are. No oxygen, hunched over, their organs aren't working properly. Your brain has to have the efficiency of transmitting the signals to the master computer, the brain, to all of your cells, and then it has to come back up again. So it's eccentric out, and then it's concentric in. Signal out, signal in. That only is attained by a proper central nervous system via this, a proper musculoskeletal system. Who talks about this?
Nobody.
It's terrible.
Nobody.
And now you'll be more aware of everyone around you. When you see almost everyone hunched over, I'm like, really? You know, come on, get spag, let's go. What? I go, your posture sucks. What's the matter? Don't you care? It's free. It's free too. Just become, aware. And then live it. And live it. And you don't have to overdo it, because you're going to die in the end. But die old with good quality of life. And I say,
I'm looking good.
Live fast, die old, and leave a good-looking corpse.
I love it.
That was fun.
You guys, thank you for
Ciao.
tuning in. Dr. Spag,
Yeah,
thank you so much.
Always.
Thank you
Nice
guys
to
for
meet
tuning
you.
in.
Arrivederci.
Ciao, ciao, ciao.
Ciao, ciao, ciao.
Lauren, you want to say ciao?
Ciao, and stand up straight.
That's right.
Hey. What's up? Yeah. Let's get Jerry. I don't know. Lie to him. Tell him we got 1 billion followers. He's not gonna check. Or maybe we get Sandler. I know somebody who shops in the same supermarket. Yeah. Let's give it a try. Or David Spade. Let's get David Spade. I don't know, threaten him. Make him an offer he can't refuse. Yeah. All right. Call me back. Bye.